All right, this video lecture deals with the pharynx, a concise review of the pharynx. So let's get going. Here's our objectives today. We want to recognize the boundaries of the pharynx. We want to list the muscles of the pharynx and their nerve supply and their function. And we want to look at the framework of the pharynx. We want to study the bones and the cartilages and the ligaments that make up the pharynx. And we also want to take a look at an MRI and some other sagittal sections and see if we can recognize the salient features of the pharynx. And here's a nice definition of the pharynx. The pharynx is a continuation of the digestive system from the oral cavity. It's a food tube. It's a funnel-shaped fibromuscular tube that is a common route for both food and air. And that's where nature has kind of played a joke on us. That's why the air channel crosses the food channel, and that's why a hot dog can turn into a deadly weapon if it wasn't for our epiglottis. The pharynx is located posterior to the nasal and oral cavities and the larynx, and we'll see that in a little bit. All right, this is a model, a plastic model of a sagittal section of the human head, and let's just kind of lay down the groundwork here for the area that we're going to be looking at today. Here's the oral cavity, here's the nasal cavity, here's the oral cavity, and here's the pharynx proper, and here's the larynx. Let's look at some of these things. There are bumps in the nasal cavity called the superior concha, middle concha, and inferior concha. They're also known as turbinates. They humidify and stir up the air before it gets into our lungs. Here's some major cartilages. There's the hyoid cartilage, which you can palpate on yourself. The thyroid cartilage, which you can palpate on yourself, and it protects the larynx. There's the cricoid cartilage, the only complete ring in the respiratory system. And down in the larynx, here labeled A, B, and C, are the vestibular fold, the ventricle, and the vocal fold. And just to note, the vocal fold, C, is known as the true vocal cord. A, the vestibular fold, is the false vocal cord. In green, we've labeled some lymphatic tissue. Here's the pharyngeal tonsil. Next to that is the opening of the eustachian or auditory tube, which is capped by the torus tubarius, which is a cartilaginous bump, which is attached to the salpingopharyngeus muscle. Here's the soft palate. Here's the hard palate. Here's the soft palate with the uvula attached right here. And here's the palatine tonsil, the one that is surgically removed, or at least used to be surgically removed. Here's the epiglottis, a mucosal covered cartilage that can flap down and cover the larynx and the airway when food passes by. And finally, here is the esophagus, which leads into the stomach from the pharynx proper. All right, here's another model, and what we're going to do is we're going to look at some of the details here in the back of the pharynx. This is the pharynx. We can label we can divide the larynx into three parts here: a nasal pharynx, an oral pharynx, and a laryngeal pharynx, all behind the given named regions. And then that ends in the esophagus. Now, if we look at the back of the pharynx here, here's the vertebral bodies, vertebral discs, right here. And of course, the spinal cord is kind of out of the picture, would be back here. But there is some layers right here on the back of the pharynx. So there's pharyngeal mucosa and muscle. And then we have what's called the buccopharyngeal fascia, which is behind the visceral portion, or the actual tube. And then we have the prevertebral fascia in black, which sits in front of the bone. And in between these two is a potential space called the retropharyngeal space. And in that space, you can puncture that, and you can get infection that can travel all the way down to the region of the heart. So that potential space, retropharyngeal space, can get infected and filled with pus. And here in the cadaver, you can actually slip your fingers behind the visceral pharynx. Here's the larynx, thyroid cartilage, the food tube, the pharynx itself. And the fingers here are actually in the retropharyngeal space, separating visceral pharynx from bony pharynx. All right, let's go on and build a pharynx right now. So here's the skull and the hyoid bone, the thyroid cartilage, the cricoid cartilage, and some tracheal rings. There's the styloid process. Here's the sphenoid with its pterygoid lamina, medial and lateral pterygoid lamina. Let's throw in some labels. Now there's a little bony hook on the medial pterygoid plate of the sphenoid, which is called the hamulus of the medial pterygoid plate. And part of the pharynx, or at least one of the constrictor muscles of the pharynx, does attach there. And here we have the other labels: hypothyroid, cricoid, and styloid process. And you can read this detail here. All right, in green we've thrown in a stylohyoid ligament. You can see it going right here from styloid to lesser horn of hyoid. A thyrohyoid membrane, which is pierced by many structures that feed and go into the larynx. And then there's a cricothyroid membrane, which is actually a point of entry when you do a tracheotomy or a cricothyroidotomy. So that's the framework. Let's start adding some muscles. All right, we have a series of constrictor muscles: the superior constrictor, middle constrictor, and inferior constrictor. And these are innervated through the pharyngeal plexus of nerves, right here. And you can see they kind of overlap like shingles here. That's so that they don't separate when you've got a lump of food, a bolus of food coming down. And we call them constrictors. Think of a boa constrictor eating a baby pig. These muscles are going to writhe and constrict and force the bolus of food down. And you can see the attachments here up on the mandible and the pterygoid hamulus, on the hyoid, and down on the thyroid cartilage, and even down to the cricoid cartilage here. Let's add another muscle called the buccinator muscle. That's a muscle of facial expression. It's done by the 7th cranial nerve. It's done by the buccal or buccal branch of the 7th nerve. Remember, there are two buccal nerves. One is sensory by trigeminal, and the other one is motor by facial. Buccinator muscle. There are several small muscles which work on the soft palate. One of them is the tensor veli palatini, right here. Makes a 90-degree angle all around the pterygoid hamulus. It's got a T. It's innervated by that trigeminal. Another one is the levator veli palatini. The levator lifts the palate from above. The tensor tenses the palate from the side. The levator is innervated by 10. The tensor is innervated by 5, the trigeminal. And here's an MRI of the pharynx right here. Here's the spinal cord, vertebral bodies. And what we're seeing here is the soft palate. And this is actually a study done with people with sleep apnea, heavy snorers. And you can see how the palate can actually occlude here, is occluding the food and the airway. So that needs to be surgically fixed. This kid's an example of sleep apnea. Down here is the epiglottis. This is the back of the tongue. Several conditions can predispose one to sleep apnea: obesity, alcohol, tobacco, anything that can interfere with the airway. All right, back to the muscles of the pharynx. Here's the stylopharyngeus muscle right here. It's a long, thin muscle, comes off the styloid process, slips down between the superior and middle constrictor to make its way to the thyroid cartilage. It's innervated by cranial nerve 9, the glossopharyngeal nerve, which wraps around it like a stripe on a barber's pole. It assists in swallowing. It kind of pulls everything up, these cartilages, up against the tongue, and assists in swallowing. Helps to close the epiglottis as you're pulling everything up against the tongue. And here's another view of the stylopharyngeus muscle from behind, long and thin, slipping between the superior constrictor and the middle constrictor. Innervated again by 9. All right, and finally down here to complete the muscular part of the pharynx is the esophagus down here. Let's throw in some other muscles in the area. The mylohyoid muscle, innervated by the trigeminal nerve, 5-3, forms a sling which keeps your tongue from falling out the bottom of your jaw. It's the mylohyoid muscle. It helps to elevate the hyoid bone, and it assists in chewing and swallowing. Trigeminal nerve. Interesting little muscle, the hyoglossus, comes from the hyoid bone, inserts on the lateral sides of the tongue, helps to depress the tongue. It's innervated by the hypoglossal nerve, and it serves as a landmark. The 12th cranial nerve sits on top of it. The lingual artery is deep to it. So you got a sandwich there. Nerve, muscle, artery. Right here. A key little landmark is the jugular foramen. And there's the internal jugular vein coming out the jugular foramen. What else goes through the jugular foramen? 9, 10, 11, jugular foramen. 9, 10, 11, jugular foramen. Here's 10, the vagus nerve, the wanderer. A very big, large, huge nerve that not only innervates structures in the neck, but goes down to innervate the heart and parts of the GI system. So it slows down the heart and it speeds up digestion, the vagus nerve. Now the vagus nerve has several key branches in the neck, in the pharynx. And the first branch is the superior laryngeal nerve. See it coming off here? Superior laryngeal nerve. And that splits into an internal laryngeal nerve and an external laryngeal nerve. So it's vagus, superior branch of the vagus, internal laryngeal nerve, external laryngeal nerve. The only darn thing the external laryngeal nerve does is innervate the cricothyroid muscle. The external laryngeal nerve, cricothyroid muscle. The internal laryngeal nerve has no motor branches, but is sensory inside the larynx, the voice box, to everything above the vocal cords. There's another nerve, which we'll see, the recurrent laryngeal, right here, which comes up from below, innervates all the muscles of the larynx, and is sensory below the vocal cords. You can read that here. Embryologically, the recurrent laryngeal nerve is different on the opposite sides of the body. On the left side, it recurs around the aorta. On the right side, it recurs around the subclavian. All has to do with the pharyngeal arches, the aortic arches, arch 4 development. Another nerve here, cranial nerve in the area, jugular foramen, 9, 10, 11, is 9. Here's 9. It crosses across the stylopharyngeus like a little stripe on a barber's pole, innervates the stylopharyngeus, and then gains access to the posterior third of the tongue, where it provides taste to the posterior third of the tongue. It also plays a role with the carotid sinus and body, controlling blood pressure. There's a small nerve called the Pharynx nerve off of 9 that goes down to the crotch of the common carotid as it splits into internal and external branches. Remember GLOPE, the glossopharyngeal nerve, 9, uses the lesser petrosal nerve to go to the otic ganglion. Out of the otic ganglion, fibers catch a ride on the auricular temporal branch of 5 and then innervate the parotid gland. That's GLOPE. And that's 9, so you can read about that. Details here. So we've got coming out of the jugular foramen 9, 10, and 11. And you can read the details here about all the little cranial nerves here and their functional components. But in the pharynx here, we can see 9, 10, and 11 jugular foramen. 12 does not come through the jugular foramen, but has its own hole called the hypoglossal canal in the basal portion of the occipital bone. So here's 9 crossing stylopharyngeus, and here's 12 hooking across to gain access to the tongue. Remember, 12 goes through the hypoglossal canal and is motor to all muscles ending in glossus except for the palatal-glossus, which is done by the vagus. 12 is GSE motor only, and it sits on top of the hyoglossus muscle. All right, these two little drawings help to emphasize the blood supply and the nerve supply of the larynx. Here's the external carotid artery. It gives off the superior thyroid artery, which goes to the top of the thyroid. The superior thyroid artery gives off the superior laryngeal artery, which accompanies the internal laryngeal nerve through the thyroid membrane to gain access to the larynx. The inferior thyroid artery gives off the inferior laryngeal artery, which accompanies the recurrent laryngeal nerve from below into the larynx. Remember, the inferior thyroid artery comes off of the thyrocervical trunk. And over here at the nerves, this is vagus, 10, vagus. Vagus is flying down to find the heart. Before it does, it gives off two big branches. One is the superior laryngeal nerve. The other one is the recurrent laryngeal nerve. The superior laryngeal nerve splits into internal laryngeal nerve and external laryngeal nerve. As we said before, the external does nothing but the cricothyroid muscle. The internal laryngeal nerve is sensory to all the areas above the vocal cords in the larynx. The recurrent laryngeal nerve is sensory to everything below the vocal cords in the larynx and is motor to all the muscles except cricothyroid. So if you bilaterally cut the recurrent laryngeal nerve, you can destroy the function of the posterior cricoarytenoid muscle, which is the only muscle to abduct the vocal cords. So you would die. So don't cut these nerves bilaterally. And again, on the left, the recurrent laryngeal goes around the aorta. On the right, the recurrent laryngeal recurs around the subclavian artery. This drawing I did demonstrates the branches of the external carotid. You remember salve forms, that hideous mnemonic. Let's see if we can get that down. It's salve forms. A hideous mnemonic, but it kind of works. All right, salve forms. What does the S stand for? We start from lower and work our way up. The S stands for superior thyroid, and here's superior thyroid right here, number 11, superior thyroid artery. The A stands for an itty-bitty little artery that comes out of the crotch of the internal and external carotid, and that is the ascending pharyngeal, number 9. The L stands for the artery that makes its way to the tongue. That would be 8 right here, the lingual. The F stands for an artery which is real curvy, tortuous, comes over the edge of the mandible to gain access to the face. That's the facial artery, number 7. O stands for occipital artery, number 4, coming back. Remember, you see that with the greater occipital nerve in the suboccipital triangle. R is the goofy one. R stands for the posterior auricular artery, which goes behind the ear. Posterior auricular, you have to say it like a pirate. That's number 3 right here. Here's the ear, would be here. Posterior auricular. M stands for the maxillary. Remember the deep face, infratemporal fossa. Number 5, the maxillary artery going deep. You had to cut away chunks of the mandible to see it. And finally, the S in salve forms is the terminal branch of the external carotid, the superficial temporal artery, which pulses, and you can see it through your skin when you're angry, mad, and upset. Right there, number 2, superficial temporal. And remember, there's some weird syndrome, temporalitis, where you can actually get some kind of weird autoimmune type inflammation that can cause you to lose hair and skin in this region, according to Dr. Shea. All right, let's see if we can label some of these structures on the posterior side of the pharynx. What we're doing is we've turned the body sideways. We're looking from behind. We've removed the bone in the vertebral column, the spinal cord. We're staring at the back of the constrictors. Let's see if we can label some of these things. There's a a pharyngobasilar fascia right here, which kind of plugs the space on the back of your throat, on the back of your pharynx. And that's pharyngobasilar fascia, PBF. What do we got here? There's a midline pharyngeal raphe. So there is a pharyngeal raphe right here. Just go PR. Pharyngeal raphe right here. Over here is just the occipital artery. We'll just put a little O there. Occipital artery. Remember that one? Here's the superior constrictor. So we'll give it a little SC. Here's the middle constrictor. MC. Hammer. Here is the internal jugular. The IJ. V. Here's sternocleidomastoid muscle. Here is just called the pharyngeal plexus of veins, so we'll just go pharyngeal veins, big deal. Here's the inferior constrictor. That's a C. And here's the common carotid. Moving on this side, here's the jugular foramen. See it right here? Jugular foramen. All right, now things get a little dicey. This little nerve here is making its way into the SCM. So what is it? It's 11, right? It's also going to do the trap. This nerve comes down, comes out of its own canal, comes down, loops around to go deep to the digastric tendon and get its way to the tongue. That happens to be 12. Right there, it's labeled in two places. So it's labeled down here, and it's also labeled up here. There's the stylopharyngeus muscle right here. So we'll just call that S. This is the sympathetic chain or trunk. That's the superior cervical ganglion. So let's just call it sympathetic chain. Here, sitting atop of stylopharyngeus, is 9. Over here, this is a little tricky one. Do you think you know what it is right here? It's not the vagus, because here's the vagus. That's the superior laryngeal nerve, which splits into internal and external laryngeal nerves. Here is the external carotid. I got fancy with an X. Here is the internal carotid. Here, they're actually labeling the ascending pharyngeal artery. Gee. Said this was 12. Ah, what is this little yellow blob in the crotch here? That is the carotid sinus. Right there. Herring's nerve coming down from 9 for blood pressure sensation. This again is sympathetic chain, another portion of it. Here is the superior thyroid artery. Right here. And here's the 10. Right there, and there's the thyroid gland. So it's scary, it's spooky, but keep your wits about you, and it's really not that bad. All right, this is a question. I don't know if you remember this one. What is wrong with this picture? Pause the tape and look at it. I'll give you 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. The inferior thyroid artery is supposed to come off the thyrocervical trunk, which comes off of the subclavian. Here they've drawn it in this textbook coming off of the common carotid. So they had to fix it in a subsequent edition. Thyrocervical trunk, inferior thyroid artery. In the dissection lab, you may have remembered that we actually had to chisel some of the basilar portion of the occipital bone, go in and carefully cut along the sides of the neck and pull and separate the visceral pharynx from the bony pharynx. So the vertebral column is back here. We're looking here at that image we just labeled. Here's the constrictors. And as we clean up the area in here, you're going to find vagus. Some of these things here are vagus and sympathetic chain. This could be like a C4 root bridging the gap here. Here's brachial plexus. All right, we're going to end with a question here. A 50-year-old male presents with a cancerous mass in the lateral wall of his pharynx that is placing pressure on the surrounding structures. He exhibits difficulty in rotating his head to the side opposite the lesion, has trouble swallowing, coupled with a loss of taste sensation. And in addition, he cannot shrug his shoulder on the side ipsilateral to the mass, to the growth. What nerve or nerves are affected? All right, let's look at this. Is it 7 and 8? Does he have trouble hearing? No. Doesn't say he has trouble hearing or with balance. And 7, it doesn't really come down into the neck that much. It's kind of more of a, stylomastoid foramen and also chorda tympani near the ear, etc. It's kind of high up. Is it vagus in 12? Well, does he have any trouble here with his tongue? Does it say that his tongue is protruding toward the side of the lesion? Does he have any heart problems? No. Is it 9 and 11? Does he have any problems rotating his head to the opposite side? Yes. Does he have trouble shrugging his shoulders? Trapezius? Yes. Does he have trouble with taste? Yes. Posterior third of the tongue. So C is the correct answer. Does he have trouble with his IOU-SO-DO, his superior oblique muscle? No. Does he have trigeminal issues? No. And is it just a 9 problem? No, because we talked about the shoulders, etc. So the correct answer is C. So the pharynx is a difficult topic. It's hard to study, but it could be worse. You could be a baby skunk that falls into a 4-foot deep post hole and has to be saved by a young woman with a spoon duct taped onto a plastic pipe and scooped out, and life goes on. Thank you. Good luck.